Welcome back on Joy News Desk. Let's now follow up on that story we brought you as we have interactions with Dr. Fred Adumaku-Boateng, Director of Health in the Bono East region, and Dr. Kwame Sapong Esiedu. Both of them were sharing their thoughts earlier this morning on the bit about vaccine boosters for COVID-19.
If you look at us who have gotten the 2 doses, and still having breakthrough infection in Bono East,
right,
I can say that none of the health workers have come down with a severe or critical form of the disease.
Right.
As for Bono East, we are collating data as to who is being infected, health worker across. We can confidently say that none of the health workers have come down with severe or critical disease.
Okay.
Nevertheless, we still have the infection, and you see the disability that comes with the infection.
Right.
Therefore, we can make a point, and you know that we will also have to take care of other people who are maybe the pregnant women, the children. So we have a point in making that at least we should get the boost. But I think the leadership of the service and the Ministry of Health are thinking about as to the way forward in terms of the booster. But
okay.
I think the data for us, we have that. I mean, there's the need for health workers to get booster. Not only that, the security officers and others, because of the nature of work that they do. Right. And mind you, if a health worker gets the infection, looking at the isolation days, if you have about, let's say, 30% or 40% of your workforce sick, and they are supposed to take some days off, you know what will happen, the long-term implications. So these are all the other things that you have to take into consideration in making a point for either people who have to get booster and others.
And we vaccinate for a number of reasons. Key amongst them is to stop mortality. That's the main thing. You don't want people to die. Then the next thing is to stop hospitalization, because if you can block hospitalization, then you don't go through severe disease, critical disease, and death. And if you can do that, then the next thing is to stop infection, and finally to stop transmission. Vaccines cannot do all these things at the same level of efficacy. So if you look at what Fred was saying, you'd realize that the global data is clear. Amongst doubly vaccinated people, risk of mortality is decreased by 97 to 98%.
Right.
Risk of hospitalization is decreased by 95%. Risk of infection is decreased by 67%. And that is where the bone of contention is coming from. I'll go to the boosters. The bone of contention is coming from many, and part of what you asked, Fred, was that those who've had 2 doses are the ones who are driving the infection. It's coming from the fact that why are people who are doubly vaccinated getting infected? The truth of the matter is that globally, if you look at all vaccines, and I'll make analogies here, one of the vaccines that has been widely used is the flu vaccine worldwide.
Right.
After the Spanish flu. The ability of that vaccine to prevent transmission is 40 to 45% in some years. But it has been in use, and we know how much it has benefited humankind from preventing mortality. So no one in the southern or western hemisphere gets a flu jab thinking, I am not going to get flu. They get it knowing that if you get flu, you would get it mildly, and your chances of hospitalization and therefore overrunning the health system is reduced, because a part of the whole thing is what Fred was talking about. You are preventing your health system from being overrun in 2 ways, with cases and from the health professional getting ill. That is why the flu vaccine is being used. So if the COVID vaccine has a comparative efficacy against prevention of infection as the flu vaccine, the question I ask myself is, on what basis are we even having the argument that the COVID vaccine should not be in use? Because in actual fact, it has a higher percentage compared with the flu vaccine. That is one thing. Then that brings me to the booster shot. You have a flu vaccine annually. And there are some people who are 80 years who've had a flu vaccine every single year. And that is what has kept them alive, because they've got chronic diseases. People have multiple bypasses. Why? Because you're dealing with a virus, and viruses mutate. So if you look at the flu vaccine, you may have trivalent, which is 3 strains in one vaccine, or quadrivalent, which is 4 strains in one vaccine. That brings me to the COVID vaccine. We are getting mutants. The advantage we've had is that the mutation of this virus has gone through a trajectory where the dominant mutant strain tends to technically wipe out all the other strains, which doesn't normally happen with the flu vaccines. And that's why you have 3 or 4 strains in there. But with the COVID vaccine, when that happens, what it means is that with like the Omicron, you have what we call immune escape, which then means that the previous vaccines that were developed using the previous known strains are not as effective, and therefore you have a booster. But when newer vaccines come on board, which are gleaned based on the strain of concern, which is the Omicron, you realize that the efficacy against preventing transmission and all that is also going to go up.